COVID-19 vaccination this and COVID-19 vaccination that. These are words many of us have been talking about with our family and friends due to fear, our own beliefs, or simply due to a lack of information. Hello, salam, namaste, and ayubawan. Welcome to Lindell Speaks podcast, Empowering Student Voice, and I'm your host, Dina Dawood. With me, my co-host Sandra Ilias from Lindell Secondary College in the greater city of Dandenong, Melbourne, Victoria.
Since 2020, we have experienced unpredictable circumstances and major changes as a result of the current and ongoing global pandemic of coronavirus disease, which is also known as COVID-19. Unfortunately, this horrible disease has caused many deaths, leaving both young and old fighting for their lives in different hospitals across Australia and even overseas.
While the coronavirus global pandemic made a new normal of social distancing and wearing face masks, it also drove multinational companies, especially those in the area of health, for vaccine research and distribution. However, creating a vaccine in under 1 year has left some people feeling uncomfortable about the COVID-19 vaccine, bringing forward the argument that the vaccine was rushed, therefore it is not safe as it should be. And in order to discuss all these matters further today, Lindell Speaks has invited staff, students, parents or carers, and members from other communities by providing them with the opportunity to soon ask important questions to our health professionals, such as doctors, scientists, and nurses on the issue of COVID-19 vaccination. But before we can welcome our panelists and hear from them, let us first go on a quick break.
Hiya friends, it's Tina and you're listening to the Lindell Speak podcast.
Yo, what's good? My name is Mark and you're listening to Lindell Speak podcast.
Jambo ndugu jamana marafiki, mimi ni Mukasa na hii ni Lindell Speak podcast.
Inshallah kullakum bikhair. Diana Daniel وانتو سامعين Lindell Speaks podcast.
Welcome back everyone to Lindell Speaks podcast, COVID-19 vaccination online forum, and we are pleased to have you join us. Now, it is with great honor for us to introduce and for you to finally meet our local and international panelists. First up is Dr. Chris Lemore, an infectious diseases and general physician, currently head of general internal medicine at Western Health.
Next, we have Dr. Jocelyn Mungala, a postdoctoral research scientist in the field of heart disease and neuroscience, particularly in dementia.
Joining us from overseas is Dr. Anmol Zahra, a medical school graduate from Dow University of Health Sciences and the founder of Health Matters.
Next, we have Jeanne Dusavi, who is a registered nurse from Box Hill Hospital, currently working in a COVID-19 ward.
And the final panelist and the representative from Monash Health is Sasha Purvis, who is working as a nurse manager. Once again, a special welcome to all of our panelists here at Lindell Speaks podcast. Over to you guys.
Good afternoon, everyone. Our first question is directed to Dr. Chris. Welcome to Lindell Speaks podcasts, and I will start by asking you this question. Can you quickly remind us what is COVID-19, how it is detected, and what are the symptoms?
Thanks very much. Thanks for inviting me to be part of this discussion. So COVID-19 is a new disease. It's caused by a coronavirus. So that's it's a group of viruses that look a little bit like a crown. That's why they're called coronaviruses. And they are the same family that cause colds, like the common cold, causing coughing and sneezing. But this one's a bit different because it doesn't stay up in the sort of nose and your upper airways. It goes right down into the lungs and causes lung inflammation, so a pneumonia. And because the bottom of the lungs are so thin and there are blood vessels that are very close, that's how we get oxygen into our bodies. The virus actually does spread into the blood vessels and causes the whole system really to become inflamed, and you can get problems in lots of different parts of the body that are because of the blood supply to those systems. So people can get blood clots and heart attacks and strokes and things like that, as well as sometimes the immune system gets really, really active and causes damage to the body while it's trying to control the viral infection. So it's only really entered humans late 2019. And because it's so contagious, it's spread all around the world. And it particularly affects seriously people who have already got some health problems, so chronic health problems. So if they've got a bit of high blood pressure, or they're a bit overweight, they've got diabetes, or they've got cancer or other conditions, their body actually suffers much worse when they get the infection, and they can become seriously ill. And because it's new, because it's never been in humans before, no one's got real immunity to it. And so people can get infected very easily.
Thank you, Dr. Chris, for your answer. Moving on to Dr. Anmol. Obviously, COVID-19 is a global pandemic because of its contagious nature. But with this being said, how has the pandemic affected your country, and what have you done as a health professional in your field to help stop the spread of the virus?
Thank you very much for having me here. My name is Dr. Anmol, and I am from Pakistan. I am a general physician working in a government setup, state-owned setup hospital, and also running my own organization named as Health Matters. COVID-19 has affected Pakistan really bad, considering the population density, which is around more than 200 million people, and the healthcare capacity we have, the existing poverty we have, and the environmental factors. 1.2 million people got infected with COVID-19 in Pakistan, with more than 28,000 deaths till yet. And the community transmission was so rapid that we were unable to control it like immediately, just because we don't have enough amount of facilities, enough amount of a good healthcare system. If I explain, healthcare system in Pakistan is kind of a dissonant riddle with limitations and rebuttals. It's around, we have 51% of Pakistan's entire population is deprived of basic healthcare facilities. And 1/3 of this population lacks access to even primary services. So the situation was extremely gloomy right from the start. And the problem is so deep-rooted, like with inaccessibility of basic healthcare services in the areas, and with so much pressure on the doctors, like limited number of doctors, it was kind of a struggle to manage overall COVID-19 in Pakistan. And also when the disease came in, it started from China, and then it spread around the world. The disease also brought in so many conspiracy theories in Pakistan that people initially were unable to even accept the fact that this is kind of a disease that can happen in the world, which can actually shut down the world overall. So that's kind of a difficult thing we had to deal with as doctors and as like healthcare professionals. My role specifically, I would say, with my team at Health Matters, we made sure to provide access to people who don't have enough access using technology. So what we did was we had our helplines available, we had our telehealth services available to those people who weren't able to access to the hospitals directly, or maybe primary healthcare centers. Our helpline services were 24/7. We actually counseled more than 50,000 people directly through our telehealth services. We are a small team of like 5 people, 5 doctors, and we were able to reach that amount of number. So I think that was something which we did, and that impacted really better. And through our digital medium, we made sure to create so many videos, so many social media content that was given out to people, so that people can, spread it among their families to avoid the hesitancy towards the treatment of this disease, and follow the basic standard operative protocols that were given to people to follow to avoid this.
Hi everyone, my name is Ibrahim, and following on from Sia's question, Dr. Amal, as the founder of Health Matters, could you please tell us about your organization and what inspired you to help other people and start something like this?
So I would say I I would just like to introduce myself a bit. I come from a family where education is not given the importance it deserves, and girls are not being promoted to acquire higher education. So it was kind of a struggle for me to pass on all those barriers and get into the field of medicine. So when I got on the stage of medical studies, I realized how important it is for me as a doctor when I become a doctor, and how I can impact my society. So I'll tell you a small incident from my hospital. I was working like 3 in the morning in the emergency room one day, and one patient presented with like drowsy. She was extremely drowsy. She had like blood stains all over her clothes, short of breath, and bleeding massively vaginally. On taking up the history, we and doing examination, we got to know that she was 3 months pregnant. She was beaten by her husband, and she was left on the road with her little 2-year-old son to get into that misery. Due to the assault, she got a miscarriage. She was bleeding profusely, and her hemoglobin levels were extremely down to 3.5, for which we needed an urgent blood transfusion. So when we asked her to arrange the transfusion blood for transfusion and everything, we got to know that she had grew up in an orphanage, from where she got married to her husband, who left her after some time, got married to another woman, used to beat the lady, only to have sexual activity, and never took responsibility of her children or maybe herself. So it was kind of a hectic emergency. My senior resident just refused to take the case because she was very tired and sleepy. I was in the misery of understanding that how can you leave a patient who is bleeding profusely, who is on the verge of death, just because this is like a police case, and there was such a lack of empathy towards the patient in need of time, and the lady was dying in sepsis. So on watching that sight of a poor lady lurching for help, I couldn't stop myself to take charge. Although I was a junior doctor, but I had to take charge, and I managed to manage the patient alone, ran after the blood bank to arrange some blood for her, made the admission file, did her dilation and evacuation thing to remove the retained products. Fortunately, we were able to manage her health. But that incident made such a deeper impact in my life that I decided to just take the responsibility of training the doctors on empathy and compassion, which is like DNA of professionalism in medicine. And that moment, I started working for Health Matters. And when I started working on Health Matters, it came to me as a very difficult picture, because every day I used to hear stories of people suffering, people not having health access, people dying just because they couldn't travel for 10 hours to get to the hospital. So that is something that inspired me to start Health Matters. And right now, Health Matters is able to provide health access to people who don't have, who have to travel around 12 hours to reach to a basic primary healthcare facility. So we do it right then and there at their village, where they don't have to travel because they are poor, they cannot afford to travel, they cannot afford the healthcare services. So we're providing free healthcare services, we're providing subsidized healthcare services through Health Matters. And also we're very focused on working on health literacy in Pakistan, because this is something people are not literate enough about their health, about their well-being. So we're focused on that to manage to provide health access in Pakistan.
Thank you very much for your response there, Dr. Anmol. It's give us a really good insight behind the inspiration for the founding of your organization. So now, without further ado, I'd like to pass it on to Melissa, who will be asking another question.
Hello, everyone. My name is Melissa. So this question is for Dr. Jocelyn. Since the main focus of this online forum is on COVID-19 vaccination, as a scientist, why is it important for us to trust the health authorities when it comes to COVID-19 and vaccination information?
Thanks, Melissa. Thank you, everyone, for having me here today. I'm Dr. Jocelyn. So in regards to your question, I think I'll speak from a scientist's point of view. I'm sure Dr. Lamar and Dr. Anmol can elaborate further, but I think it's important for us to actually listen to health authorities. There's a lot of misinformation out there regarding the COVID vaccine, which we know have circulated among social media, the news, but I think we should trust the health authorities because they know what they're doing. So there's a lot of resources available to sort of give information about what is COVID vaccine, how is the COVID vaccine made, and what vaccination options are available for people out there, specifically for the younger generations, which vaccine is best for you guys to take. So I think I've heard this question asked to me a million times. And I think I always tell people is to seek advice from your doctor. So go to your doctor, let them know that you want to get the COVID vaccine. And then obviously then they'll give you options. They'll give you a list of what vaccines are available. And as an individual, you can then make that choice yourself. It is very important that we follow health authorities because we know how deadly COVID has been and how fast it is spreading throughout the community. And I think the only way that we can actually we can't live without the disease in the community is by getting vaccinated. So it's very important that we're all sort of informed on the disease and the current situations at hand so we can better manage it to sort of live a normal life again after this pandemic.
Thank you so much for your response, Dr. Jocelyn. Could you describe how we were able to develop a new vaccine within the span of a year and a half? Aren't there strict protocols or processes in not only the creation of the vaccine, but having it thoroughly tested on various individuals from different age groups and genders to ensure its safety and its distribution?
Thank you for your question. So under normal circumstances, when you don't have a pandemic like COVID, it takes around 10 to 15 years to actually develop a vaccine. But as we know, the COVID is very deadly. It was spreading very, very fast amongst the community around the world. So I think it sort of became a worldwide collaboration. And by that, I mean that there was increased funding when it comes to COVID-19 research, which means the government were able to provide more money for researchers all around the world to sort of get this research underway to try and find a vaccine for COVID, and which was actually really good because it allowed researchers to collaborate with one another, to share their data based on what research findings they get from the COVID in regards to the COVID-19 disease. And I think one of the best things about it is because it was spreading so fast, some of the red tapes are normally, in order to create a vaccine, there's a whole lot of rules and regulations that you have to go through. But because we couldn't actually wait, all the red tapes were sort of lifted. So which means that the vaccine was able to be made at a faster pace than usual. And I think, as we can see now, we've sort of come a long way from the beginning of the pandemic to now, where we're actually able to get vaccinated and people are starting to live a normal life again. So I think that's how we were able to sort of make the vaccine very fast in terms of the efficacy of the vaccine. The vaccine just wasn't just made overnight. There's been a lot of research that has been put into developing this vaccine. So under every single drug that we get, every vaccine, you do a clinical trial. So the COVID-19 vaccine was tested from phase 1 clinical trials, where you sort of test out how safe the vaccine is and what are the symptoms and how are people reacting to the vaccine, all the way to phase 2, 3, and 4. So it was very well tested. And I know social media is not the greatest thing at this. There's so much misinformation that the vaccine was not made properly. There's all these other random components that have been added to the vaccine, and that's why there's so many people who are hesitant to sort of get vaccinated. But I can definitely tell you that it is a safe vaccine, just like your polio vaccine that we all got as children. The COVID-19 vaccine is actually quite effective, and as we can tell now, the more people who are vaccinated, the less likely they're able to catch the disease. So that's my answer for that question. Thank you.
Yeah, thanks for clarifying that, Dr. Jocelyn. I think a lot of people were definitely anxious about that. Before we go on to the nurses, I'd like to ask Dr. Chris. So as a health professional who's dealt with different patients with different beliefs and opinions, what would you say to those people who are still anxious about how there's a high potential for fatalities, since the vaccine is still new and some people are still worried about it being a foreign substance that's being introduced to our body?
Okay, no, thanks for the question. I guess the thing I would say is that why do you trust information? Why do you believe what someone tells you? What are the things that make you trust that person's information versus someone else? First, do they know what they're talking about? Have they done the study? Have they had the training to know what they're talking about? Another thing is, what's their motivation? Are they in it for themselves? Are they in it for profit? Are they in it for their egos? Or are they in it to do good? Or are they just in it to do their job? How do they get, punished if they say something wrong? Are they answerable to anybody? Can they just say any old rubbish, or do they have to tell the truth because someone will actually discipline them if they don't? And this is why there is a reason that it's good to believe scientists, to believe health professionals, to believe government officials, because we actually do train, we do study, and there is quite a rigorous training that we have to go in order to even get our qualifications. When we practice, we are regulated. We have to answer to not just our employers, but to bodies that control our registration. And if we start just telling any old rubbish, we get struck off the register. We can't practice anymore. And a lot of people would say, and I'm sure Dr. Anmal would testify to this, you don't go into medicine for the money as a rule, because there are other ways to make more money. Most people go into medicine, do it because they want to help people and because it's interesting and it's good to work with people and actually see a direct effect of working with someone that makes their life better. And some people do make money from it, but that's not usually the primary motivation. So for all of that, the people that study the vaccines and have developed the vaccines have actually been doing it for many years. The technology for the mRNA vaccines has been around since before 2003, the first SARS epidemic. And it is a platform which has been developed over many, many years that's been adapted to this new disease. It's not just come out of the sky. The collaboration between all the scientists is possible because of internet and communications these days. It can take minutes to do something that would have taken weeks to do before, to share huge amounts of information. So things are happening faster than they ever have before, and we're able to get all of this information to our hands and actually use it in a time that would have not been imaginable a few years ago. So that makes the quantity of information quite daunting, quite scary. But there are people who are paid to go through that and report, to sort out what's actually true from what's not. As far as the safety of the vaccine is concerned, there's never been a vaccine that has been so closely scrutinized about safety. So every time that there's a dose that's given, it's recorded. Every time someone gets any reaction, it's reported. And that all goes into a system to check, what experiences people have had after the vaccines. And if something happens that looks like there's side effects, it gets analyzed and people see, is this just by chance or is it actually related to the vaccine and who's at risk of the side effect? And it gets reported pretty fast. So that's why that clotting disorder with the AstraZeneca vaccine was picked up much, much faster than it would ever have been a few years ago. And now there are people who can't have that vaccine, but who can have the other vaccines like the Pfizer vaccine. And by the same token, there are people who should not have the Pfizer vaccine, they should have the AstraZeneca. But we can actually say that to people and say, you're the kind of person who it's best, this vaccine is safest for you, this vaccine is not so safe for you. So those systems are so much better than they used to be. And it's much better to trust those than to trust random people who are ego tripping on the internet to make themselves feel important.
Thank you, Dr. Chris, for your insight. It was mentioned earlier that you are currently working in the COVID-19 ward at Box Hill Hospital. Could you please give us in-depth detail to how the experience has been for you? Oh, Sharon, sorry. Jana, sorry.
That's all right. Hi, everybody. My name is Jean, and I am a registered nurse, and I have worked in a COVID ward. I am not currently working there. I'm usually an oncology and hematology nurse, but a few weeks ago, obviously, when the when all the numbers started going up with all the new cases up to 2000s, our hospital became a COVID streaming hospital. And what that essentially meant is anybody around the eastern suburbs within the northern suburbs, and if there were a suspected COVID patient, they would come to us. So what it meant for me was I also had to work in a COVID ward. Initially, it wasn't my decision. It was kind of like, okay, we need staff to go up to the wards because we don't have enough staff up into the COVID wards. So while I was on nights, I was sent to work my first night shift in a COVID ward, which was very daunting. But from there, I really learned a lot. My experience from working in a COVID was it's very real. Yes, obviously being a nurse, I knew COVID was real anyway, but being there and seeing people who are around my age. So we had a few people who are in late 20s or early 30s as well. And they did not have any comorbidities and they were pretty much quite unwell. And I've been nursing for about 5 years and never in my life have I ever looked after patients whose oxygen drops so quickly from 90s to 70s. So that was quite eye-opening. And I know from my own peers, friends and families who are aware of the whole COVID pandemic and what's going on. And a lot of them were saying, oh, no, surely those who are in hospital are people who are much older and who have comorbidities. But from my own personal experience looking after those patients, a lot of the patients I looked after did not have a lot of comorbidities. And I did look after a young man who was only 33 years old, did not have any comorbidities, but was very anti-vaccine essentially, and was found to be positive at the time as well. And he was so unwell. And that was quite eye-opening for me as a nurse and also as a young person to go out there and say to my friends and families who were a bit funny about the vaccines and the whole COVID-19 affecting young people and saying, look, it can affect anybody. And yes, you could have the best immune system, but it all depends on the situation and what's going on in your life. And yeah. So that was my personal experience working in a COVID ward, and also going back to my hematology ward, which I went back to my, so hematology and oncology is looking after cancer patients who are immunosuppressed and they are very unwell. And unfortunately, if they were to get COVID-19, they would be very, very unwell. And a lot of them would not be able to fight it off because they don't have immune system. So going back to my regular position as oncology and hematology nurse, specialist nurse, I was able to educate my patients and also advocate for them and really just tell them what I've seen from my own personal experience working as a COVID nurse for a few shifts, and just encourage them, if it's obviously safe to do so, depending on where they are with their treatments of cancer, to definitely get the vaccine.
Thank you for that. Jean, as a nurse working in a tough environment, what do you wish people do to help stop the spread of the virus?
Well, what I wish people would do is really get them vaccinated, as a lot of the other panelists have mentioned, the importance of getting the vaccine, because as we all know, social media have a way of interacting with people's decisions to get the vaccine. So what I have recommended and what I would recommend is, if you can, get the vaccine. It's definitely better to get the vaccine than not to get the vaccine. And, you know, a lot of the people who are looked after were people who were unvaccinated. So it's a 30-bed ward and 28 of those patients were not vaccinated. 2 of them were partially vaccinated. So what does that tell us? People need to get vaccinated. And of course, I understand that people are anxious about getting vaccinated, which is very fair. But I would suggest to look at the pros and the cons and speak to your GP from there.
Thank you so much for sharing with us. So my next question is for Sasha. As nurse manager at Monash Health, I'm sure that you are very busy managing people, especially during these tough times. What are some challenges you or your colleagues face regularly throughout this pandemic?
Hi, I'm Sasha, as you say. Thank you very much for inviting me. I can't believe any of you were nervous about presenting. You're all fantastic. I know that I feel more nervous, I'm sure, than you. Now, challenges, there have been quite a few. First of all, we had to find a workforce. Vaccinations traditionally has been delivered by the GP, sometimes flu season by the chemist. If we have a school program, we might have a new vaccine come out, the Gardasil, the HPV vaccine. We targeted that when that first came out to a specific group of teenagers, whereas for our COVID vaccines, we had a population that we had to try and find a workforce for. So training up a large amount of people in a relatively short time to make sure they have all the specialist knowledge in order to answer all of the questions that we get faced with. And to reassure people and to give, all the specialist information that people need to be able to make an informed decision as to, what vaccine they want, when they're happy to have it, and that they're happy to proceed. Now, sometimes as well, some of the challenge can actually be in the information sharing. So we find that information can change from 8 o'clock in the morning to 11 o'clock in the morning to midday. Sometimes at 7 o'clock in the evening, I might watch the news and I might find an information outlet from the government about a new vaccination change that's coming the next day. So we often have to jump very quickly to be able to give out the right information to everybody as to which vaccine they're entitled to and eligible for, and what that eligibility is. Other challenges that I've had are more on a personal level for all of us. So, I'm sure if the nurses on the ward will attest, it's general fatigue. We're all going, from 6:30 in the morning until 6:30, 7 o'clock in the evening. We're constantly talking, we're constantly administering, we're doing a very repetitive job. We want to be able to give, the freshest outlook to everybody coming through, because of course, when you're on the other end of a vaccination, this is all new to you, whereas we might have done several hundred, just by ourselves that day. So it's making sure that, we are, available and fresh for you guys. So we're giving you the right information. And then one of the other challenges, I guess, is I'm working in the pop-up vaccination centres at the moment. So quite frequently you might find me in a drafty car park, in a school performing theatre, in a school basketball court, putting up a vaccination centre, wondering how that's actually going to look and where we're going to put everything. And making sure that everything goes to track. So certainly I never know where my day is heading off to, and sometimes even what I'll be doing tomorrow.
Yeah, Sasha, I think we're all very proud and grateful for all the work that all our frontline nurses and doctors have been doing, as well as everyone on the panel as well. I would like to ask you as well, unfortunately, our municipality, the City of Greater Dandenong, has one of the lowest rates of vaccination in Victoria. And we'd like to ask, what is our state government, your hospital and our council, what are they planning to do to address this low vaccination rate?
You're absolutely right. We did find that some of the local government authorities had much lower rates of vaccination in the postcode. Obviously, that's a worry. I've worked in the Greater Dandenong area as a community health nurse for about the past 8 years. So, I frequently go out to Dandenong, Springvale, Keysborough, visit a lot of very vulnerable people, living with, as we've talked about, multiple medical conditions, who are all very vulnerable to getting a very serious form of coronavirus. So certainly we really want to protect those guys by protecting younger guys as well. So what we decided in conjunction with the state government, Monash Health, and with Dandenong Council too, was we started doing a lot more of our pop-ups. So we put up a very big tent, you might have noticed, down near the Palm Plaza, in between Dandenong Market and in between the Plaza Shopping Centre. And initially that tent was to actually try and encourage people who have found a lot of barriers. So around Greater Dandenong, language can sometimes be a barrier, certainly transportation. People don't, always just have a car to hand. It can be very difficult and very scary to get on a bus during COVID times. So we thought if we can put up a tent where everybody goes and does their shopping, wouldn't that be great that people can just walk in? They don't need an appointment. They can just come down and get their vaccination. So certainly the Department of Health, Monash, providing the staff, and Dandenong Council working with us to make sure we had all the right permits. We put up our tent for 2 weeks, and just over 6 weeks later, we're still going. Because guess what? By putting up a tent, we actually found that it wasn't due to vaccine hesitancy that the numbers in Dandenong were low. It's because people just couldn't access that appointment. So our latest figures that we've actually got out show that in the Greater Dandenong area, over 90% of people have had their first dose now, which is an amazing, amazing amount of people. And then for second doses, we're at 68, so we're not far off the national average. We're growing much quicker than comparable LGAs who had smaller numbers like Dandenong did. So people are actually really, really keen, and they're coming down. And certainly in the Marquee, we've seen amazing families coming through. You've got 3 generations of, mum and dad have come in with their parents and with the children as well. We've had amazing families coming through. We have interpreters in the tent as well to make sure that all the correct information is given and that people are happy to go ahead, and we're happy to answer any questions at all. So we've been really thrilled and, lucky and blessed to be able to, give the service that we can in this area to such a wonderful, vibrant community. Now, also as well, we're coming to your school, as you know, this weekend. So we're trying to actually come out and do smaller sites in more local areas too. So, often people feel happier to come to somewhere where they are familiar, they have connections to, so we'll be down at Lindale on Saturday and Sunday. We've done some schools in the local Casey area as well. And, we're looking to do more and more. So, we have taken up your basketball court. Your PE teacher was very sad about that the other day. And hopefully if any of you or your friends, your family members, anyone in the local community wants to come down, Saturday 10 till 6 and Sunday from 9 till 5. You don't need an appointment. You can just walk straight on in and we'll be able to help you with a vaccine.
Thank you for that statement. So from the very beginning of the pandemic, us young people, we were told that the senior citizens were more prone to the effects of the COVID-19 disease. So why is it now that over the past year that we are more informed consistently that we should be vaccinated, and usually adolescents between the ages of 9 to 18 should be more vaccinated? I'll first like to call to the stand Dr. Chris, and then have him being followed by Dr. Jocelyn in terms of the responses.
Thanks for that. It's funny how that perception has changed. It's not wrong to say that older people are at higher risk of getting seriously ill, but that doesn't mean that young people are at very low risk or no risk. It's a very individual thing. It depends on your immune system, your general health, and what strain of virus you get. So you put all of that into the mix, and it's actually quite unpredictable. And the statistics are all about large numbers, but each infection happens to a single person, and it's much harder to predict what happens to a single person. When it first appeared in China, it was pretty clear that people who were older did worse. But at the same time, younger people were getting infected. And as it spread more and more and more through the world and through populations, it finds the people who are going to get worse. So a lot of people don't get sick much at all. They get very mild symptoms or minimal symptoms. But amongst all of those people who get mild symptoms and pass it on, mild symptoms, pass it on, there'll be a person who gets really sick. And that can be a person of any age, can be a baby, can be a young teenager, can be an adult, can be an older person. And because everybody is susceptible, it is very infectious. It will find all of those people and they'll turn up. And so the more spread there is through the community, then the more likely it is that the people who get it might be one of the unlucky ones who get seriously ill, even if they're of a younger age.
Just going off to what Dr. Chris Limmer has just said, I actually had a very close friend. She was only 26 last year, and she actually contacted COVID-19, and she was very healthy, very fit, just young, living her life as usual, worked in hospitality. When she got sick with COVID-19, I think she was one of the first few people who I know who's quite young to get the disease. And people wouldn't actually believe her when she said she had symptoms early on until she got tested and proved positive. And it just comes to show once again that as young people, we tend to think that we're immune to the disease, we're immune to getting COVID-19. But just like Dr. Chris Lemmer has just said, anyone can get it. My friend was 26. She was pretty sick till this day. She still faces a little bit of symptoms. So she has a little bit of breathing problems once in a while when she goes for a jog. But I think it's just important that we obviously look after ourselves, get vaccinated, and sort of, I guess, keep others in mind, not just ourselves. Because yes, while I may be healthy, I may get symptoms of COVID. I might not really get sick, but the next person next to me who might have a lesser immune system or weaker immune system than myself might be able to get it worse than I am. So I think it's very important that we sort of keep ourselves informed and get vaccinated.
Thank you, Dr. Chris, for that. This just shows that we shouldn't underestimate the power of this coronavirus disease. And Dr. Jocelyn, what can we expect our lives, especially our health as a community, to look like once we reach at 80 or 90% vaccination rate?
Thank you for the question. So it's a very hard one to answer because unfortunately, I can't say that we'll ever go back to living life as normal as we did pre-COVID. And I think as anyone who's in Melbourne or Sydney or wherever you are at the moment, we all know how the pandemic has affected everyone. But I think moving forward, we sort of have to live with the disease. And by that, I mean just being vigilant when we go out in the community. And by that also means we should not get complacent. So we shouldn't just give up now that we're reaching that 80%, 90% milestone. Doesn't mean we stop doing our hand washing technique or we stop wearing masks. As a person who's fully vaccinated, when I still go out in public, even on the buses or even in like the park, if the area is feeling a bit crowded, I still tend to wear my mask, not just because I'm scared obviously of getting sick, but I can also get the vaccine even if I'm fully vaccinated. And I think for me, it's important to look after myself because I constantly come into work, and while I may not get the disease while I'm out there, I might be able to pass it on to someone else. So I think it's very important to just keep doing what you're doing at the moment by wearing your mask and doing your hand washing and just sort of trying to be safe and think about other people as well out there in the community.
Thank you so much, Dr. Jocelyn. You've really, I guess, reminded us all of, everything that was said at the beginning of this pandemic, that over the months and over lockdowns, we've sort of tended to less regard, like as Victorians, with so many lockdowns, we've sort of become more, I guess, not as worried as, we should be to, protect ourselves from this virus. And as we are about to finish off our formal segment, before we leave, this is an open question to all of our panelists, but I'll first start with Dr. Anmol. Why is it important for everyone to get vaccinated? And then after Dr. Anmol, I'll have Jean, then Sasha, and then Dr. Jocelyn, and finally Dr. Chris.
Thank you very much for your question. As Dr. Jocelyn said, that it's not just for ourselves, it's for everybody around us. If we get vaccinated, we protect ourselves and also people around us. So if I just talk about why do we need to get vaccinated, it's simply that vaccination reduces your risk of infection. Once you receive your first shot, your body begins producing antibodies to the coronavirus, and those antibodies protect you and help your immune system fight this virus if you happen to be exposed. So it ultimately reduces your chance of getting the disease. Similarly, if it's true that you can still become infected after being vaccinated, but once more of the population is vaccinated, the chances are good that we will have sort of a herd immunity. So it's important for all of us to get vaccinated. It protects us from getting severely ill because studies have been showing, and even like I directly have experienced in my hospital. Jean also said that she has experienced as a nurse in the hospital that people who were vaccinated, like they have a less chance of getting a severe illness in comparison to people who have not been vaccinated. So even if you get infected after being vaccinated, it would be mild to moderate in comparison to those who are not vaccinated. So your risk of hospitalization and death because of COVID is nearly eliminated once you're fully vaccinated. So it's better for all of us to go for it whenever we get the chance. I am fully vaccinated. I promote this in my society, in my hospital, in the people I get in touch with, all the patients I treat, and similarly as all the doctors here, all the nurses here who are promoting this. I think we all should take our personal responsibilities and get vaccinated for ourselves and for others around us.
Thank you. Thanks again, guys. Definitely agree with what Dr. Moore just said, and of course Jocelyn as well. It is definitely better to get vaccinated, and I would highly recommend, if you can get vaccinated, definitely do, because really you have to think of other people. Just because I know I'm fully vaccinated, even though I know I can definitely get COVID-19, but I know that I am less infectious and less likely to pass it on to people who might not be able to fight off the infections, the virus itself, and also just in consideration to family members or even friends who have medical reasons why they can't get vaccinated right now, either due to chronic disease or chemotherapy. They can't get vaccinated, but me getting vaccinated reduces the risk of them having to obviously get unwell because I've got the virus and I've passed it on to them. So, yeah.
Like all your lovely speakers here, there's just so many benefits to getting vaccinated. So the virus, unfortunately, is very, very clever. And if not enough of us get vaccinated, that's where it starts to mutate and it starts to turn into other versions of itself. And we have to start the vaccination process again at that point. So it's really important that as many of us who can get vaccinated now. And I kind of think of it in three ways. The most important reason to do it, firstly, is for you, your family, and those you love. You just want to protect them. You want to live your best life. You want to be able to do, as much as you can in your life, and you don't want to have the effects of coronavirus. So being vaccinated, prime reason number one, is for you and your families. And then another equally good reason is for everyone on the panel today. We all work in health. We want to do our best for you. We want to keep you safe. And, when you come into our hospitals, we want to give you the best care. But we're getting pretty tired at the moment. There's very long shifts. Not everybody coming in will need us for coronavirus. Whilst coronavirus is happening, people are still falling over at the skateboard park or having accidents when they're doing, funny dances to TikTok and they need to come into the emergency. Or we've just got all our normal diseases like diabetes and high blood pressure, and we want to be able to treat your families and heaven forbid you as well if you need to come into hospital and to be fresh. And the third reason is just we want to get back to life, all of us, Who remembers a time when they didn't have to think about going to a cafe and, giving a green tick? Or I immunized a lovely 13-year-old boy the other day whose prime reason for coming in was he just wanted to get back to the gym. He missed being able to work out and he just wanted to get back to that semblance of, as much of a normal life as life will evolve to. So I think they're my top reasons for doing it. And, it makes sense to me and hopefully it makes sense to everybody listening. Thank you.
I don't have very much to add, but I think the panel's pretty much summed it up quite nicely. We all know the importance of getting vaccinated to protect ourselves and our community. So I definitely would encourage for those who haven't got vaccinated, go see your doctor and then seek out information on what's available. And I'd definitely say get vaccinated so then we can sort of move forward and go back to living on, post COVID life.
Yeah, thanks. Yeah, I agree. Getting vaccinated is a really good idea. It makes you less likely to get the infection. If you get the infection, it makes you less likely to get seriously ill. And if you get ill, it makes you less likely to die. So those are good reasons to protect yourself, to protect others. And the people that we infect are the ones who are closest to us, both physically and emotionally. So whole households can become sick. And then the ones who are most likely to get sick in those households are the ones that we love the most. So protecting others is really important with the vaccine. And then slowing down the spread of infection to just keep things under control so that we can provide care to people for everything that they need, both COVID and other conditions, so that people can remain healthy and well and get on with living, life that we want to live. And it's affected all of society. It's taken all of the things we really find make life meaningful and worthwhile and stripped it away. And we really don't want to live like that for any longer than we absolutely have to. And getting vaccinated is the way that we can get back to a life. It won't be the same as what it was before, but it will be better than it is now. And hopefully some of the lessons that we've learned from dealing with COVID help us make society better than it used to be when it comes to justice and access to care, access to healthcare, and equal opportunities for everyone. And on a related note, I would just like to say, with all of the panel that we can see in front of us and you, the students that are interviewing us, education, especially education for women and for girls, is the single most important and urgent issue for humanity in general. And I cannot emphasize that enough. So I'm just so happy to be part of this, and really privileged to be here answering your questions. So thank you very much.
Thanks everyone for your thoughts and advice on the COVID-19 vaccination. Before we take further questions from our attendees, now let us watch a short video from our college community about the importance of COVID-19 vaccination messages in different languages.
The COVID-19 pandemic is still threatening our livelihood and the rest of the world.
Therefore, a vaccine is a great hope to find a solution to control the virus infection.
COVID-19 vaccines are effective because they will help you from getting seriously ill,
even if you do get the virus. So help protect yourself and your loved ones by getting vaccinated today.
د کووید-19 وبا لا هم زموږ په ژوندانه او پاتې نړۍ کې یو لوی ګواښ دی. له همدې له امله واکسین د ویروس انتان مخنیوي لپاره د حل موندلو یوه هیله ده. واکسینونه مؤثر ځکه دی چې دا به تاسو سره د جدي ناروغي کېدو کې مرسته وکړي، حتی که تاسو ویروس ترلاسه کړئ. نو نن ورځ د واکسین په ترلاسه کولو سره د ځان او خپل عزیزانو په ساتنه کې مرسته وکړئ. مننه.
अस्सलाम वालेकुम। कोविड-19 वबाई बीमारी अब भी हमारी रोज़मर्रा और बाकी दुनिया के लिए ख़तरा है, लिहाजा एक वैक्सीन वायरस इन्फेक्शन को कंट्रोल करने का हल तलाश करने की एक बड़ी उम्मीद है। ये वैक्सीन मुअस्सर है क्योंकि ये आपको शदीद बीमार होने से बचाने में मदद करेगी, चाहे आपको वायरस हो भी जाए। आज ही वैक्सीन करवाकर अपनी और अपने प्यारों की हिफाजत में मदद करें। शुक्रिया.
شیوع کووید-19 هنوز هم معیشت زندگی ما و بقیه جهان را تهدید می کند. بنابراین واکسین یک امید بزرگ برای یافتن راه حل جهت کنترل و جلوگیری عفونت این ویروس محسوب می گردد. واکسین های کووید-19 خیلی مؤثر پنداشته می شوند، زیرا این واکسین ها به شما کمک می کنند تا حتی در صورت ابتلا به این ویروس دچار بیماری شدید نشوید. بنابراین با تطبیق واکسیناسیون امروز از خود و عزیزان خود محافظت کنید. تشکر.
وكذا فهي لازم ناخذ اللقاح بتاع ضد الكورونا. فاللقاح يعني في الدراسات الحالية اللي أجريت كلها أثبتت إنه يعني كل الأنواع بتاعة اللقاحات ضد الكورونا هي آمنة ويعني سليمة 100%. يعني حتى الأشياء اللي بتظهر دي هي عرضية، يعني ما حاجة كده مثلا تخلي الزول عشان يعزف يقول إنه أنا مثلا ما عايز أخذ كده. فلما الإنسان ياخذ اللقاح بتاع الكورونا فده يعني بيحميه، بتقوي الجهاز المناعي بتاع الإنسان ويحميه، يعني مش بيحميك مش أنت بس، يعني بيحميك وبيحمي أسرتك وبيحمي الناس اللي حواليك. يعني الفائدة كبيرة جدا. وبرضه تاني يعني بيقلل نسبة دخولك للمستشفى والله إصابتك بمثلا بمرض شديد والله بمرض مزمن أو ممكن يؤدي لحياتك. فمهم جدا يعني إحنا نلتزم الطرق الأولية بس عشان نوغي روحنا، وثانيا ممكن ناخذ اللقاح عشان نقدر نحمي أنفسنا.
And that is it now, ladies and gentlemen, as we have reached the end of our segment. But before we leave, Lindell Speaks team, including us, would like to express our utmost gratitude to our local and international panelists for taking some time from their very busy schedules to speak with our college community about the importance of COVID-19 vaccination. A big thank you to Dr. Chris Lamar, Dr. Anwar Zahra, Jean Zusabe, Sasha Purvis, and Dr. Jocelyn Mulangala. And on that note, many thanks to everyone who joined this online forum today, and we hope to have you next time. This is Lindell Speaks Podcast. Goodbye for now.